While people are starting to join, I will slowly start the introduction. I will say again to everybody that is joining now, good morning, good afternoon, and good evening. My name is Marty van Lieren, and I am the program lead of the Healthy Mothers, Healthy Babies Consortium, which is hosted by the Micronutrient Forum. The consortium aims to drive collective action for improving maternal nutrition and specifically to accelerate the introduction of multiple micronutrient supplements in settings where diets are poor, indicators of anemia, low birth weight, etc. are high, and where multiple micronutrient supplementation can have a significant improvement on maternal nutrition status. Today is the third of our series of coffee and chai chats with experts around various MMS-related topics. Before I introduce today's guests, I would like to quickly take you through the format of the chat, as it is slightly different from the previous ones in case you attended these, because we have two speakers today instead of one. First, our guests will chat with each other over a coffee or a tea for 15 minutes about the role of maternal nutrition in maternal health and what more can be done. During this time, we ask all the participants to mute their mics, or actually we will do it. Our technical person will do that. After their engagement, their dialogue, there's time for you to ask questions and carry the discussion forward. At that time, we will unmute you and you can raise questions. You can put up your hands through the button that is for that, or you just wave your hands and I'll try to identify. But you can also type your question in the chat box. Once you're called upon to speak, please unmute yourself while everybody else stays muted, and then mute yourself when you are done. That will help avoid the background noise. We also would like to ask everybody, if they haven't done so, to put their name and organization in the title of their Zoom window so that I can invite and address you with the right name. The total chat is for 30 minutes, and we would like to give everybody who is interested a chance to be part of the discussion. So we hope that that is possible. At this moment, I can see that we have about 7 people that are joining, but I know that before we had 25 or over 25. So I'm positive that more will join the discussion. In case you have any technical difficulties, please type in the chat. Now, I will start by introducing our speakers. Very pleased to welcome to this Coffee and Chai Chat 2 highly esteemed guests. First, Dr. Saskia Osendarp from the Netherlands and Dr. Hema Divakar from India. Hema, could you please show your screen? Thank you. Dr. Hema Divakar is one of the best gynecologists in India, I believe, and a medical doctor at Divakar's medical director also at Divakar Specialty Hospital in Bangalore. I first had the pleasure to experience Dr. Hema's passion and enthusiasm when I started following the maternal nutrition e-dialogues that are organized by Dr. Divakar, but also with the Nutrition Institute of India, the National Institute of Nutrition, UNICEF, Sight and Life, and others. Dr. Hema holds prominent positions within India and abroad, and she was, amongst others, the head of the Federation of Obstetrics and Gynecological Societies of India, FOGSI. She's also a technical expert with the Institute of Public Health and the Government of India Initiative. Now, Saskia is an executive director of the Micronutrient Forum, an international expert organization that is a knowledge broker in the area of micronutrient malnutrition. The organization is based in Washington, though Saskia is based in the Netherlands. She has more than 25 years of experience in international nutrition research in both public and private sector. And Saskia is also a visiting associate professor at the Wageningen University in the Netherlands. Recently, Saskia has been the co-founder and the co-lead of the Standing Together for Nutrition Consortium, a collaboration of experts working in nutrition, food systems, health and economics, that analyzed the impact of the COVID pandemic on malnutrition. And today, Saskia and Dr. Hema will speak about the role of maternal nutrition in maternal health and what more can be done. I'm delighted that both of you have made the time to be here with us. Looking forward to a stimulating discussion. Now, today is the first day of the World Congress of FIGO, the International Federation of Gynecologists and Obstetricians. And Dr. Hema, when I started looking at the program, and of course, I'm a nutritionist, so I'm looking for nutrition, I actually thought there were very, very few sessions that are addressing nutrition. Do you know why this is? Could you talk to that? And then I leave it to the both of you to engage in your chat.
Sure. Thank you, Marty. And namaste and welcome to Saskia as well, our very distinguished guest on this program of Healthy Moms and Healthy Babies. And as rightly pointed out by Marty, the Federation of Obstetricians and Gynecologists, that is the FIGO. All of us as OBGYNs have in the past never ever thought of nutrition as a prescription. It is just a, by the way, like a chai and coffee chat that we are having. It is, not a hardcore technical medical responsibility of the OBGYNs as clinicians or practitioners. That was the major mind block. And now that we have realized that it's not only a healthy mom gives rise to a healthy baby, but the healthy women make a healthy nation, because it's not only for them, but even for the baby growing in their womb. It is so very crucial that these babies should be programmed in the proper optimal nutritional environment. So the new dawn, as if to say, Marty and Saskia, we have now broken the silos and we are connecting and collaborating as hardcore OBGYN clinicians with the nutritionists, the dietitians, the cross-sectoral policymakers, and everybody who is involved. And the nation has launched what is called the Poshan Abhiyan, which means eat right, and the importance placed on the nutrition to the entire nation in the entire life course, right from birth, womb to tomb, as how we may call it. So I guess that, yes, today you're disappointed that there are a few sessions only, not as much as you would have wanted to, but you will see our journey also progress alongside. And I promise that it's our responsibility, but the next annual event of FIGO will have many more sessions, because we do consider it as the central piece for wellness. So that is what I would like to say. Yes, Saskia, what do you think?
Yeah, no, thanks, Dr. Hema, and thanks for clarifying this. And I must admit that even in the nutrition space, I think for a long time, maternal nutrition has been really ignored or not sufficiently being considered, despite the fact that we knew, of course, that the 1,000 days are so important for the development of the child and for the next generation. And if you look at that all the way down from the funding that's being invested in maternal and child health programs, you see that that systematically most of that funding is going to child nutrition programs, and very little of that funding, only 18% of that budget, has been allocated to maternal nutrition programs. So I think the fact that it has been ignored has been seen not only in maternal health, but also in the nutrition field. And yet we know that it is so critical, maternal nutrition is so critical to lay the foundation for a healthy child. We know that still up to today, 23 million children worldwide are being born with low birth weight. And that's to a large extent due to poor maternal nutrition during pregnancy, and we've not seen much progress either in the reduction of the prevalence, for instance, of women who are underweight. Today, still more than 240 million women of reproductive age are underweight. The women that are anemic today, 613 million, or 1/3 of all women of reproductive age. That's not just in low middle income countries, that's also in high income countries, are anemic. And we know that all of these are risk factors for poor pregnancy outcomes. And we also know, because that's clearly laid out also by the WHO in their antenatal care guidances, that there are important nutrition interventions that need to be considered to be provided during antenatal care. And many of those are very effective, not only in improving improving maternal nutritional status and anemia, but also in improving birth outcomes. But they still suffer from a very low coverage in antenatal care, and it needs to be really further scaled up and invested in.
Absolutely. I couldn't agree more, because I think both of us have voiced out that more importance and more attention should be paid to this component. And also, to my mind, it is, it's not like a quick fix only in the antenatal care. Even the pre-pregnancy time point is so very crucial, because Rome was not built in a day, and we cannot do everything in that short span of time that is available. And the tsunami of the triple burden, as we may call it, even in countries like India, there's a whole swing: malnutrition, which encompasses the undernutrition on one hand, and at the other end of the spectrum, we have a large number, not only in urban, but also in the rural India, of the obese population. There is so much change in the lifestyle, even, right across the country. And that is slowly escalating the burden of obesity as well. And in the middle, the sandwiched portion of the micronutrient deficiency, and the important key things being the supply chain and the understanding and the compliance and everything which has to reach the last mile to have the necessary impact. So it is not, it's obviously a complex issue. And slowly and steadily, we have to tease out the pieces of this.
There are these interlinkages as well, right? So we know, for instance, that people who are overweight, they have a higher risk of becoming iron deficient, because the fact that they are overweight means that they are not as well able to absorb iron from their diet. We also know that children that are born with low birth weight, it's not just a matter of being small. It's a matter that have implications for this child during their entire life. When they're children, they will have a higher risk of mortality, of infectious diseases. And when they grow up, they actually have a higher risk of becoming obese or overweight and suffer from chronic diseases themselves. And I think, so that's why we always say it is an intergenerational problem, and you need to make sure that you start the problem from the roots, and that you make sure that women are well nourished, as you said, before they enter pregnancy, but definitely also during pregnancy. And that's why, we are discussing now in these chats, but also I think more broader, the options that we know more or less what to do. We know there are effective interventions. If there's undernutrition rates in women are very high, they need balanced energy protein supplementation. And in settings where there is a high prevalence of low birth weight and of anemia, women need to have access to these maternal micronutrient supplements, which this chat series is about, which are supplements that have been proven to be highly effective in reducing anemia, but also in improving pregnancy outcomes. 12%. You heard that, I think.
Saskia, Saskia, as you speak, there is one more important issue which is in the forefront, especially in developing countries, when you look at it from the gender lens, because as if like a cherry on the cake, capping this whole problem is a problem of gender inequity, because there is so much that the women has to get, which she deserves and she doesn't get. And it's only in a small segment in her life that when she gets pregnant, she's pampered, that too with the intention of getting a healthy baby out there, but the family doesn't recognize that, there is so much more to it than what it meets the eyes, because the Barker's hypothesis, the programming of the baby in utero, the long-term implications of the mother not being, adequately nourished on both factors, like, and also having comorbidities, like she has high sugar, she has hypertension. All of these also, enhance the wrong kind of programming in utero. So, for example, diabetes in pregnancy, very well, the OBGYNs have now been sensitized that if you do not control her sugars in the limited time available to you through the pregnancy, then this child is sure to be a case of childhood obesity and early onset type 2 diabetes. So there's a lot more attention that we pay for GDM today and NCD tomorrow. That is how sequence
I think
goes.
that link should be made far more clear. Now, Dr. Hema, I have a question to you. So in your context, where do you see opportunities to strengthen more the links between maternal health and maternal nutrition?
I think that we should think out of the box, and all stakeholders right across, that's why we say the life course approach, because it is not only in pre-pregnancy is one point, pregnancy is another point, beyond pregnancy is the third, the child at birth is another, infancy, the young adulthood, and then as they move on in their life course, at every touch point. When we say every touch point, it's not only the healthcare providers who have to be involved in this whole exercise of telling people to eat right, but it is all the stakeholders, whether it is communications and workplace environment in the schools and colleges, and the buzz that is created around eating right, the social media and every other point. And then the policymakers, when they make the policy, how it is interlinked and implemented. That is crucial. We have to walk the talk, Saskia. That's what I feel.
Yeah. And do you think that within the antenatal care, there is sufficient collaboration between maternal nutrition and maternal health? I know you're organizing these maternal e-dialogues. Do you pay attention there to nutrition issues as well?
That is, the whole of the maternal e-dialogues, we thought to ourselves that one event like this is just not going to be enough. So let's do it on the last Friday of every month. So consistently, this is the 10th in the series. Actually, we are running in collaboration with FOXI, UNICEF, National Nutrition Institute of India, and Alive and Thrive, and many other stakeholders who have come together. So last Friday of every month, we deliberate with the target audience of all of the mix of the people whom I mentioned. Everybody has to come together, put their brains, and there's so much learning from evidence which is translating into practice. Where are the gaps? What better can we do? And we know the problems, but we brainstorm on the solutions and how to make it implementable. So I think it's been a very important series of events, especially because the first step of breaking the silos and coming together is in itself a great achievement. And then we have learned that across the country, there are so many who are doing so many things, but each one is like a different part of an elephant. You see, we don't know what's happening just in the neighborhood. So coming together has taught us many things on which we can collaborate, synergize, amplify, scale, and I think it's been a very exciting series, and some action points have already begun.
Yeah, very good concept, and I think it should be considered in more countries to duplicate and learn from. I think also from our end, I think today, as Marty already alluded to, it's the start of the FIGO conference, which I think up to date has been paying little attention to maternal nutrition in general. And I think if they paid attention to maternal nutrition, it particularly was on the issue of maternal overweight and risk factors of overnutrition. I think it's good to know that Healthy Mothers, Healthy Babies Consortium with partners has organized a session which is in the maternal and fetal health track. It's a recorded session that people can go and watch as part of the FIGO conference program. And that will have some further details on how to improve maternal nutrition, the evidence behind effective interventions, the evidence about what is needed to scale up, for instance, with multiple micronutrient supplement interventions, etc. I'm looking at time, Dr. Hema, and I'm wondering if there are any questions from the other participants to us. I think there's one from Ott.
Hallo.
Statika. Oh, Go ahead,
Hello.
Dr. Taslim.
Utu and Samaya Tasneem both have some questions for us, I think. Yeah, please go ahead.
Thank you for all of you who invite me to talk to very diverse ladies. I'm the PhD in microbiology, working last 20 years of this field. The infection control mechanism and personal and women hygiene is a big issue. Most of disease and septic shocks and disorders come to the infection control and nutrition management system, because the our education is not fulfilled to design the curriculum to how can develop the healthy and happy life. A lot of Pakistani women and other Asian and developing country women have so much stress. In after COVID and latest era, if the Pakistani women work outside some finances resources, get some financial resources, have double pressure, because in back to the home, you also working in home environment and pressurized to the work and fulfill the so many duties. So lot of stress, lot of work. If the women have not proper nutritionist, take the nutritionist diet and balance hygienic problem, because a lot of in recently big city major problem availability of water is also big issues, and these areas in Asian areas are the so much humidity, the hot weather is prolonged, so much difficulties to the infection is spreading.
Yes, Amaya, thank you for your inputs, because you have got other allied systems which also make a difference. So I would like to place on records that most of the programs which we are doing are under the series of health and hygiene, because both are so very well integrated. And I think both the fact that the health is well and prevention is better than cure, and the hygiene from the point of this COVID precautions has got the new limelight onto this whole issue, if I may say. And as you said, nutrition per se, hardcore, that's a problem. But when cultural factors, economies, access, then other things like sanitation and availability, etc., add to it, it only makes it more complex. So everything is going to be like overwhelming to start with, but we've got to start somewhere and we've got to move ahead. And we have to move the needle, and thinking about yesterday will not make a better tomorrow. So if we haven't done much about it yesterday, I think the time is here and now. That is what, because
I think it's also important to mention, Dr. Taslim, that in humanitarian emergency situations, there are specific guidances, as you may know, again, for maternal and antenatal care. And I think to kind of ensure maternal and antenatal care in these very dire circumstances. And I think they also include deliberately very specific maternal nutrition interventions, because we know that when the woman is well fed or better fed, that at least she will be able to, she will gain some resistance and resilience against some of these circumstances. I also want to go back to the chat, because Dr. Santika had a question there about Figo's opinion to Unimap MMS. Dr. Santika, I'm not from Figo, and I'm not sure if Dr. Hema can speak on behalf of Figo, but I don't know if Figo has an opinion on Unimap MMS. All that I know is that MMS has now recently been included in the WHO Essential Medicine List, which was an important next step for countries now, which will enable them to further disseminate and scale up the use and the production and the supply chain of this maternal micronutrient supplement intervention.
Yes,
So Dr.
Saskia,
Hema,
I would like to say, as you said, on behalf of FIGO, that FIGO has launched an initiative called the PONI Initiative, which is Pregnancy, Obesity, Nutrition Initiative. And there's a FIGO nutrition checklist, which can be administered in 2 minutes, even in a busy clinic. So this is more to sensitize the clinicians that they have to think nutrition first. So that is the tagline, in fact, of the committee which is working for this. And they look at high income countries and low middle income countries as a stratified approach. And for low middle income countries, for sure, in the recommendations, they have added the micronutrient supplementation, and this has strengthened our local professional organizations to approach the policymakers and change the government guidelines within our own countries as well. So the journey is on, but the gap between knowing and doing, that's where we are putting in our efforts to make things happen.
Yeah, I think it's also good to mention, Dr. Santika, and you can always contact us or someone else from the Healthy Mothers, Healthy Babies Consortium, but there are currently efforts underway, also from UNICEF and others, to help to further translate what it means that these type of interventions are included now in the essential medicine list. And as Dr. Hema alluded to, this will tremendously help in future, but it's been a recent edition. I think it was published only on October the 1st. So it's now set in motion.
And, there are other constraints in countries like ours as to the supply chains of iron folic acid, which has been, there for decades. Then
yes,
is there enough supply available? Now we are monitoring and evaluating about the supplies, and we are also monitoring and evaluating whether the compliance has been achieved, and the comorbidities inclusive of malaria and other infectious diseases have been tackled. And on top of it, to reach the target levels of hemoglobin, one simple example. So if that is not reached, then you have to seek alternative pathways to make sure that she and the baby get enough supply. So the use of parental iron, which is also in the recommendation. So there's a lot of things happening. At least, the thinking is the first thing, doing is another, and seeing to it that it reaches as many as possible. So we have to fast track with the availability of the digital technology. And I think it is, and it should be possible. Let's all stay positive on the fact with the hope that, yes, we will be able to, together, we will surely be able to do.
Yeah, there are a number of challenges still on the implementation. I think in the design and implementation of antenatal care in general, and of some of these nutrition interventions in particular. And Dr. Hema, whether you are addressing to the issue of supply chain, there are issues with compliance. And I think there's more research now going on also on innovative behavioral techniques, as you said, with the e-learning and other technologies that have promising results, and that are going to be shared and where programs can learn from now. So I just want to add one more thing, because we have also been working with a group of scientists globally, and also scientists from India on the impacts of COVID on different forms of malnutrition, because we know, of course, that it's been disrupting health systems. It has also been disrupting food systems, and it has basically led to increases in food prices, particularly of nutritious foods. We've seen there also that there is a risk of an additional number of women that become malnourished with low BMI or with anemia. And it's possibly COVID alone can lead to an additional 4.8 million maternal anemia cases by 2022. So I think that's another reason why there I think is an acceleration of the interest to invest more in maternal nutrition and improving maternal nutrition as an important element of maternal and reproductive health. So
and as Amaya Tasneem also said, there are enough and more problems in the developing countries, and in the COVID times, one of the major impacts has been all of these pregnant women used to get the food supply, a hot cooked meal every afternoon through the government, and that came to a grinding halt.
Yes.
And poverty is a big issue, and if they, it was just as if the food was taken away from them. So that was a bit very, very disheartening to have that break during COVID. So that is, as how things emerge, I think we will figure out the way of what better we can do, and how much more effective we can be as the journey moves along.
Yeah.
And
I think we're about time. I'm not sure if there are any other questions from the participants.
I have looked at the chat and I haven't seen any other questions, but I can see that this is the beginning of a dialogue, whether it's online like today or offline. I'm sure that we will keep this dialogue between maternal health and maternal nutrition going. That is for sure. For the nutrition people, it's an exciting time because we're going towards Nutrition for Growth in December, a big summit where many commitments will be made, and there's a lot going to happen around women nutrition. So those are exciting times. And again, for the women health experts, maternal health experts, this week is an important moment with the World Congress of FIGO. I would like to thank you, Dr. Hema and Saskia, for this interesting discussion. We have recorded this, or we're still recording, and that means that this can also be shared online so that people that have not been able to dial in now will be able to listen to it. For those on the line who would like to know more about MMS, please look at our website, it's in the chat. Ask, look at the Knowledge Hub. There's a lot of papers that are uploaded there, a lot of good information. And I would like to tell you that our next chat is next week, 27th of October, with Mr. Mulamba Diese, who is an expert working out of the Democratic Republic of the Congo, and will talk to us about the experience of distributing MMS in his country. So thank you again to everybody who was here. Thank you to the speakers, and I'm looking forward to see you next time for another quick chat. Bye-bye.
Thank you so much. Namaste. Thank you.